Hello. I'm sorry that due to work commitments in Brussels, I am unable to attend the conference on Keeping Ireland Fit for Work. The important issues you are discussing today are precisely the issues that I deal with on a regular basis as an MEP, particularly as a member of the European Parliament's Employment and Social Affairs Committee. Indeed, I met with Gráinne O'Leary, Head of Education and Support with Arthritis Ireland last September to discuss the impact of musculoskeletal disorders in the workplace and potential EU responses. Under the EU 2020 strategies, EU governments have agreed a common target of achieving an employment rate of 75% by 2020. Achieving this target will not be easy, but it is worth striving for. A 2012 study found that reaching a 75% employment rate would not only bring the EU unemployment rate down from 12% to 5%, but would also result in positive budgetary net effects of up to €1.2 trillion, or 7.4% of GDP. I am convinced that such initiatives as Fit for Work have an important role to play in achieving this target. It is worth noting that about 50% of workers in Europe do not have access to preventative services at their workplace, especially in the SMEs and subcontracting chains. As you may be aware, the European Commission is currently finalising its evaluation of the 2007-2012 EU strategy on health and safety at work. It is due to publish this evaluation over the coming weeks. According to the indications, this strategy has succeeded in its aim of reducing the total incidence of accidents at work across the EU by 25%. So setting up quantitative targets for reducing work accidents seems to have worked. It has also raised the visibility of this policy area and encouraged Member States to focus on measures to promote health and safety in the workplace. The Commission has said that its evaluation will serve as the basis for a public consultation to identify future priorities for a possible new European strategy. I believe that it is vitally important that the Commission comes forward with a new strategy covering the next 7 years. 23 million people in the EU, 1 in 10 employed persons, report at least one work-related health problem each year. Almost 170,000 people die from work-related accidents or diseases annually. Another 7 million are injured in work-related accidents. Chronic musculoskeletal pain affects 100 million people across Europe. 40 million workers across Europe are affected by musculoskeletal disorders, MSDs, attributable to their work. MSDs are the most common cause of absence from work for European workers, accounting for nearly half of all absences from work and nearly 2/3 of permanent work incapacity. These and other socio-economic consequences of suffering from poor health due to muscle and joint pain represents an estimated cost to society in Europe of up to €240 billion. EU social dialogue has produced around 80 texts on health and safety, relating in particular to emerging risks such as MSDs. The European Parliament has already called for new EU legislation on MSDs covering all European workers. The Commission has indicated that it is considering giving priority to tackling health issues and preventing work-related issues, including MSDs, under any new EU strategy. Such a new EU strategy would help complement initiatives such as the Fit for Work initiative and help us meet the main targets of the EU 2020 strategy. But to achieve this ambitious goal, a life course perspective has to be applied. Access to prevention and primary care must also be prioritised by the EU and by Member States. We also need to develop mechanisms to tackle the detrimental impact of chronic diseases on active and healthy ageing over the entire lifespan. Better occupational health and safety is a key factor for growth and the creation of new and better jobs. The cost of work-related accidents and conditions such as MSD to industry and society is enormous. We all have an interest in reducing that cost, particularly in times of economic and financial crisis. The reality is that good health is good business. Investing in preventing accidents and conditions such as MSDs in the workplace helps improve economic performance, bolsters our social security systems. I am delighted to see stakeholders in Ireland to take the lead on these issues today. I want to assure you that I am very happy to work with you on these issues as MEP for Dublin. I would like to wish you a very successful conference. Thank you.